Infection is this week's concept. So infection, as we know, is the invasion of body tissue by microorganisms with the potential to cause illness or disease. Take a minute and see if you could create a concept map around infection just from what you know. So in the middle you'd put infection, and in each square, what would you add for patho? Some nursing diagnoses. What would you assess for? What would you look for interventions, and how would you evaluate that? You could even add to the side somewhere some possible complications of infection. There are 4 categories of microorganisms that cause infection in humans. They include bacteria, viruses, fungi, and parasites. Types of infection could be local, systemic, or bacteremia, acute, or chronic. We always want to remember that we have this chain of infection, right? And so microorganism has to have that reservoir to get in, and portal of entry and exit, and method of transmission, and you need that susceptible host as well. So how is it that we could then decrease risks of infection if we know this piece of the chain link? Some viral infections could include what you see on these slides. So we're fairly familiar with things like the cold and pneumonia. Sometimes some of us will get gastroenteritis or eye infections. But there's also the sexually transmitted diseases, encephalitis, meningitis, hepatitis, skin infections, and so on. Here are some examples of bacterial infections: bacterial meningitis, otitis media. You can have this type of pneumonia as well. Again, skin infection. So it just depends, again, on what is causing. And in Michelle's class, in your patho, you should be getting more information related to that. So here are some examples of parasitic infections. And yeast and fungal infections. So what concepts are related to infection? Well, we just covered inflammation, and you've covered nutrition. Look how things are building upon itself. Tissue integrity is our largest organ is your skin. If you have openings within the skin, you have open reservoirs. Immunity and stress are some other examples of concepts related to infection. Who could be possibly at risk for infection? Well, we could look at this in a multitude of ways. Healthcare personnel are at risk just because of the nature of our business. Clients within the acute care or clinics, and then communities as a whole, if you think about epidemics and pandemics. Some things that would also put clients at risk would be some things like cardiovascular changes, respiratory changes, nutritional changes, skin and subcutaneous tissue changes, what is going on with their immune system, decreased activity level, right? Risk for dehydration, chronic disease, diabetes, cardiac, renal, chronic medication use, not getting appropriate immunizations. Altered mental status puts us at risk. Hospitalization, and any invasive devices that we do, such as indwelling catheters, gastric tubes, IVs, that sort. So how do we decrease those risks? Well, as you learned in your CNA courses, donning your PPE and hand washing is key, but let's even think about a greater picture than that in how do we get our patients to decrease their risks, right? So go back to one of those first slides on the chain link, right? And how do we decrease risks related to that? So proper nutrition, making sure we hand wash, making sure that we are looking at medications and do we still need those, vaccinations, even as simple as teaching our toddler girls how to wipe from front to back when they're using the bathroom. So think about that and how even keeping your environment clean will decrease those types of risks. So how are we as nurses going to assess for infection? Sure, you want nursing history. What are their immunization records? Ask them about their nutritional intake, including fluids, sleep patterns, level of stress, any history of recurrent infections, what medications they are. And on page 577 is actually a great list of assessments for within your Pearson book, from vital signs, your ear assessment, your oral cavity, your eye assessment, lymph nodes, respiratory assessment, and continues on with the next page, your skin assessment and urinary assessment. So I would look at that and review those pieces of the puzzle for further information. One of the ways we're going to help the medical team assess for infection is diagnostics on the next slide. Diagnostics might include your WBC differential, so you need to know your labs, procalcitonin, which may increase with infection and sepsis, some serological testing, which is indirect method of identifying antibodies that are related to the suspected organism, direct antigen detection methods, X-ray, antibiotic peak and trough to determine whether we're at therapeutic levels of prescribed medications. Maybe a lumbar puncture to determine cerebrospinal fluid for examination and culture of the CNS. Ultrasonic exams to evaluate organs. Specimen collection, sputum, urine, wound, feces, urinalysis, culture of wounds would all be key as well. Infection screening if you're public health, so looking for things such as TB and sexually transmitted diseases. So what do you think could possibly be some nursing diagnosis related to infection? Great time to pull out your handy dandy little nursing diagnosis reference book and have a peek. Some of them we've already used. Imbalanced nutrition, when we went over nutrition concept. Disturbed sleep pattern we went over with our sleep apnea patient in the obesity world. Impaired gas exchange. Maybe this is a pneumonia patient and they're not getting the appropriate gas exchange. Acute pain, sometimes appendicitis, right, would have acute pain. So review that and see what else you can come up with. Once we have those diagnoses, that then determines what interventions. Some of those interventions may be independent, some of them may be collaborative. So for instance, an independent intervention would be hand washing, medical asepsis, standard precautions, isolation, sterile field, protective equipment, rest and comfort measures. Collaborative may be things like surgery, antibiotics, antipyretics, vaccinations, nutritional support, fluids, IV fluids specifically, disinfection of your physical environment. We might look at interventions around wound care. Proper technique is always really important with wound care. Food hygiene, so that goes back to safety, right? Suctioning, catheter care. So those of you who are working as CNAs, and it's always talked to us about a perineal care, especially when patients have indwelling catheters. We may look at pre-surgical antibiotics as well. Reassessing as we go along, and evaluation of those interventions we'll talk about in a little bit. Some antibiotics that we would need to think about are on the next few slides. So the first one, or I should say medication treatments, because it's not going to be maybe just antibiotics, but also possibly antifungals. Antipyretics and analgesics would help us with the symptoms of those infections. Consequences of uncontrolled infection is really important, and you'll see this even more so when you're in the clinical settings. Once the body's system is compensated, then your body systems start to shut down to try and take care of that infection. So you may go into septic shock, which then would lead to multi-system failure and then possibly death. So that could be your possible worst outcome. So when we talk about that care plan, we did interventions. Now, what would our evaluations include? Our goal would be that client will remain free of infection as evidenced by maybe its absence of fever and chills, that pulse within normal limits, voiding clear urine without reports of frequency, urgency, and burning. Maybe it's as evidenced by WBCs and differential counts are within normal range. So that would be just a few examples. So now that we went through that quick and down and dirty 12 minutes of infection and your readings, what would you maybe add to that map? The other tool for this, and I should have mentioned it earlier, could be those nurse think notes. So what is it that you've gathered more information on to help you think through the care of a patient with infection? See you in class.